Chapter 12, The Blast Technique, Accelerated EMDR. Where does BLAST fit in? You might have heard of EMDR, eye movement desensitization reprogramming, which has become the standard treatment for PTSD in veterans. Its benefits were so significant that its use has become widespread. It's now used in conditions including anorexia, anxiety, depression, and more. Of the more than 100 therapies out there, only a handful rise to prominence and become embedded. Solution-focused therapy, EMDR, and blast therapy are all new kids on the block, comparatively speaking, emerging in 1978, 1987, and 2008, respectively, and they emerged because they worked. Origins of EMDR, the forerunner of blast. Scientific American in 1987 called EMDR the brainchild of serendipity. It actually emerged in a solution-focused way, following what worked and doing more of it. You've got to love a great and simple story. They're often only partially accurate, of course. Francine Shapiro, who was then a psychology research fellow, strolled in the park while she was having some intrusive thoughts. Then, spontaneously moving her eyes from side to side while she was walking, she became calmer. Realizing this could be something special, she honed her method, one session and one person at a time. That solution-focused approach of doing more of what works. She worked on herself, then friends and colleagues, before publishing her work in 1989. There's no debate as to whether EMDR works, with a stack of papers supporting its use. There does remain ongoing debate about how EMDR works. Emergence of blast and use cases. So why do I offer blast rather than EMDR? EMDR recommends 3 to 6 sessions for simple traumas and 6 to 8 for complex trauma. And that sounds a lot. Actually, it's not a lot. It's really fast for therapy. And I was picked up on this on X, formerly Twitter, by someone who said EMDR was too fast already. Honestly, for me, EMDR is not fast enough, though. Blast therapy compresses and reorders the steps of EMDR, much shorter, more direct, and more effective. It was developed by Nick Davis, a hypnotherapist who's continually improved the method to be even more effective and streamlined. Often it can take one session. As I mentioned before, my own issue was cured in 6 minutes. Here's a sample of the issues I've treated with blast. Fear of hospitals and a critical operation the following day. Having a business wrecked by a criminal and no legal recourse. An eminent doctor with paralysing imposter syndrome. A child who was sexually assaulted. A nervous star recruit for an important interview. A stressed mum dividing her energy between parents and children. A business owner with severe anxiety. An anorexic facing hospital admission. A traumatised new mum by the delivery of her baby, and the often forgotten dad who must stand by helpless. Almost anything, it just works, and it works quickly. I read lots of Twitter, now X threads, on why some traumas can't be erased or rationalised. Blast doesn't claim to do that. It reprocesses traumas to file them away and not have them sit there right up front, causing us to react to triggers constantly. There may still be some pain, and it may still be a raw memory. It's our being triggered and affected by it that changes. I'm a children's A&E consultant, and I know I might have mentioned it. I don't have enough patience to spend multiple sessions getting to the nub of the therapy. The speed of blast therapy has clear benefits in terms of cost to clients, including you, and the time required. It also means that where the therapists are in limited supply, we can help many more people. We're getting increasingly used to many mental health services being squeezed to become only available to those most affected. Making more rapid and effective treatments available creates the potential to treat more people at an earlier stage and potentially better outcomes overall. While this book is focused on imposter syndrome, it also works in other areas close to clinical practice. It works when patients have gone through a challenging clinical situation or have ongoing pain or scars. It's also helpful when they have complained about treatment and feel stuck and unable to move forward. As we've seen, some memories and traumas are particularly challenging, and attempts at processing them or filing them quietly away fail. These sit up front so that as soon as a trigger comes in, we react so fast that the brain's no time to register the trigger. We often look back and wonder what happened, as if we weren't aware of consciously formulating a response. The only way to shift these is to reprocess them. How does blast therapy or EMDR work? We can't answer this for sure, and that's slightly embarrassing. The essential component is bilateral alternating stimulation, light, tapping, clicking, or sounds. Even moving the eyes from side to side without recalling a memory can calm and settle our heart rate and breathing. Stimulating one side after the other may prevent the two sides of the brain from communicating, and that allows space to reprocess the memory. As we've seen, traumatic memories cause problems because they get stuck and can't be filed away. They sit there triggering emotional responses whenever we get a trigger to that memory. We react before our brains even recognize they've been triggered. Reprocessing the traumatic memories enables them to be filed away in the cortex, which acts like the brain's library. It stops them from sitting up front in the brain and affecting our day-to-day lives. They may be on or below the surface or buried quite deeply. The same bilateral stimulation can retrieve traumas before reprocessing them if we need them to. What happens in the session? Some therapists will provide information about blast before the session so clients know what to expect. Others will describe the process as part of the session. First of all, find the nub, the trauma. The issue is discussed, listening for specific moments or emotions that may act as triggers. Clients may know the issue, the moments and feelings involved. For others, events may lie just below the surface and need some probing or regression to surface them. Or the circumstances might be deeply buried, needing regression therapy to bring them into our consciousness. Regression sounds like serious therapy speak. It's a process of looking back to find the events or reactions which relate to the issues brought by the client. And it's not as scary as it sounds, but it may surface memories so awful that we could only have carried on if we buried them. Clients like you might struggle to identify the trauma. They may even have too many to choose from. If it's the latter, it can help to select the first or the worst example. Interestingly, it's not always the event or circumstance we think is responsible. In my therapy, it was something completely different. Sometimes it's not the obvious headline trauma, but something or someone that let us down, that caused the hurt, anger, and maybe shame. The good news is that for similar experiences, treating the first or the worst with blast therapy might cause the rest to come tumbling down too. The same sort of trauma with the same kind of reactions. If we reprocess one, we may have reprocessed them all. Doing this embedded in a solution-focused session allows us to look at what we might want to happen going forward. It's not just that we want the trauma or stuff resolved. We want life to be better afterwards. The real trauma might surface after starting the therapy, and that's fine. We can come back to that once we deal with the current issue. Emotions, sensations, and locations. This isn't some random fishing trip hoping the right memory might bite. It is laser-focused, using the client's words to describe their emotions. They don't even need to be actual words. One of mine was avoidy. What sensations do you feel when conjuring up those events and emotions? Tightness, butterflies, nausea? And where in the body do you feel that? In your chest, in your head, in your throat? The Richter scale or trauma magnitude. How bad does it feel going there now when discussing the trauma and the emotions anchored to it? Like the pain scale, we use 1 to 10, where 10 is the highest. Going back to your trauma can feel scary. That's completely understandable. Remember that memory is affecting you profoundly and often. Blast therapy takes you back there just once, so you don't have to return there again. One and done. Keep going, it should be the last time you experience this trigger. During the eye movements after each pause, clients are asked where they are now on the scale, which often falls in large jumps. The real therapy, eye movements. We spend considerable effort finding the trauma, its emotions, sensations, and locations. We then ask the client, yourself, to let it sit back and focus on following the light. It's essential to conjure up the trigger. Once it's been conjured up, it'll be reprocessed in the background. You don't need to concentrate directly on it. You can't while you follow the light correctly. The eye movements are short periods of following a light, often on a pen, keeping your head still and following the light as far to each side as possible. They're short periods, as that's all that's needed, and doing longer in one go would be too hard on the client. The therapist can see tells when the reprocessing is happening. These can be deep breaths, eye jerks, seat shifting, or other body reactions. I felt suddenly sick after a few deeper breaths, which I hadn't even noticed. The number of these periods varies depending on how quickly clients come down on that Richter scale. The rating doesn't need to reach 0, but it does need to reduce. A low score might be acceptable to clients, as they may want to remember how dangerous the original situation was. Many clients become much calmer. They might feel like a shaken snow globe where the reprocessing might continue after the therapy finishes. Like the snow globe, things can take some time to settle completely. These were traumas we've held on to for years, remember. Call your trauma back. You can do it. Once the rating is low and the therapy has succeeded, the client is asked to return to the trauma. And clients often think this will be easy, only they can't do it. There will be a memory, but the trigger's gone. Many clients describe the trauma as drifting away, being behind a veil or something similar. It's sort of there, but they can't bring it back. Clients understand that it has gone, and it won't come back. Other triggers might surface, but that one has gone. Embedding new emotions. The therapist actively listens for new positive messages or emotions. Then, using eye movements again, they amplify and embed these. That is BLAST in brief. It's a powerful tool we can use in a pile of situations. When we understand that imposter syndrome is due to trauma, we can use this routinely to cure it. After BLAST therapy particularly, some people seem to have a sort of woolly, the trauma moved away, but I still know about it feeling. And that makes sense. If you've been triggered repeatedly by a traumatic memory or traumatic memories, it takes time to let go. It will settle, and then things will never be the same again. For me, it felt really weird. I hadn't appreciated the traumatic memory, and yet everything had changed. Times when I expected to react, I didn't. It just never came. I'm genuinely free of it, and it saves me so much time and effort. Your trauma is personal. Others often didn't even register what happened to you. Your peers might have spookily similar traumas, having been through the same system. Healthcare worldwide could value its staff better, that's for sure. Please don't hold it in. Please don't listen to the activities and mindsets we keep being told will help. They're too hard. You've already maxed out on the effort you put in. Medical schools reliably pick the most resilient canaries in the mine. When these canaries fall over, rather than change the healthcare service or system, they look for more resilient canaries. Let a BLAST therapist banish imposter syndrome in a few hours or less. Then you'll feel suddenly you have the energy and headspace to do those well-being activities. We have things back to front. Therapy and then well-being are the way to go. Well-being's meant to be positive and healing, not a miserable mandatory grind. The exception is those unable to engage in therapy, who may need rhythmical dance, group drumming, singing, yoga or massage to start feeling present enough in their bodies to engage.